All right, good evening, everyone. I'm actually going to take a quick peek to make sure that this is actually live, so bear with me if it is live. Just go ahead and start dropping in your questions. As obviously, this is Lillian Bravo, Director of Public Health Partnerships. We also have Nathan, our local emergency response coordinator, as well as Sean McGee, our environmental health director. So I know a lot of people likely will have questions about schools. We won't actually be taking any questions about schools. We don't have someone that can answer those today, but we will be having a press conference tomorrow at 11 a.m. We'll be live streaming that and also recording it for anyone who misses it. So if you do have questions about schools, feel free to put them in the chat box and we can send them over to the panelists to make sure that they get addressed tomorrow. Otherwise, we will be focusing pretty much on vaccines and open air dining and the questions about indoor dining for today. So let's take a quick pause so I can make sure that this is working and we'll get right to it. 1 second. Okay, gonna be totally honest, I don't see this happen in the background, so let me keep checking.
Yeah, I don't see it on the Facebook page either.
You don't?
No.
Okay.
No, and usually in the Zoom meeting in the upper left corner, it'll say Facebook Live.
Oh, it's still preparing. Okay. Let's see. Oh, I have to click go live. Okay, all right, starting over. 1 second.
It's there now.
Okay, thanks, Sean. Yes, meeting is now streaming live on Facebook. Good evening, everyone. So we'll take a quick minute to just introduce everyone that's on for tonight. So myself, Lillian Bravo, Director of Public Health Partnerships, I'll be looking for your questions. So if you have any questions, make sure to put them in the chat box. That's what I'll be looking at on the Facebook chat box. I know a lot of people will likely have questions about schools, given the announcement earlier today. We won't be answering any of the questions about schools because we will be having a press conference with several panelists tomorrow at 11 a.m. So we'll make sure that that gets streamed live for anyone that's available. For anyone that's not available, we'll also be posting that onto our YouTube channel so you can view it later. So tonight we will be able to answer questions related to the vaccines because we have Nathan Johnson, the local emergency response coordinator, and also any questions related to restaurants, businesses, environmental health, anyone that's looking at septic system water. Sean's your guy too. So I know we haven't gotten a lot of non-COVID questions lately, but those still are out there. So feel free to ask any questions related to those two topics. If you have other questions that aren't necessary, that we won't be able to answer tonight, again, I encourage you to still put them in the chat box. That way we can share it to the right people and we can make sure to get those questions answered either at the press conference tomorrow or in some other method. So to go ahead and start, Nathan, I know today we sent out some more updated information on vaccines. What's the latest? I know it sounds like we got more vaccine this week.
Yeah, absolutely. So we got in about 2,900 doses of first dose into the county this week and 1,000 booster doses. As a total, we've received roughly about 14,505 first doses, and we've administered 13,067 of those. And then we've received 4,950 booster doses or the second dose, and we've administered 2,832 of those. And just a quick caveat on those numbers is we are finding that in the Pfizer, specifically using the Johnson & Johnson Vantage Point needles, providers are able to pull out an extra dose. So that instead of getting the 5 doses that it's earmarked for, they're getting 6 doses. And then with Moderna, they're oftentimes being able to have enough left in the vial for a complete dose as well. So they're getting 11 doses instead of the 10 doses that the vial is earmarked for. So we continue getting in vaccine into the county. It is at a limited amount still though. Our primary goal is to get as much vaccine into the county and into our healthcare providers' hands who are distributing this. Our FQHCs, our federally qualified medical centers, such as Farm Workers Clinic, Neighborhood Health, Community Health Central Washington, our hospitals, Yakima Valley Memorial, Community Health of Central Washington, Ashtree Sunnyside, and Ashtree Toppenish are all really stepping up and ensuring that they're pushing out that vaccine quickly. It's open to anybody, whether you're one of their patients or not. And it's free. There's no out-of-pocket cost for anybody who gets the vaccine. Again, our goal is to get as much into their hands as possible. We know that long-term, we can't continue to let them shoulder that load. There's a lot of people who need to get vaccinated, and we have to have different options for community members. So we are working on other infrastructures throughout the community, one of which being the Yakima Valley Sundome site. That site is developed to be a supplement to our healthcare partners and not the end-all be-all for vaccine distribution. Again, that site won't go live until we get enough vaccine into the county to not only support our healthcare providers, but also to be able to consistently support that site as well. Until then, our doses are limited each week. Our providers are working hard to get that out as quickly as we can. You can either use findyourphasewa.org to figure out what phase you fall under and the list of locations on where to get the vaccine here in Yakima County. But we always recommend people to look at our website for most up-to-date information as to who has the vaccine, who's scheduling appointments, and who's not, and how someone needs to schedule that appointment. We keep that updated real time as providers run out of vaccine. We'll make a note on there or completely remove them. So we try to have that information easily accessible to the community as far as where to get the vaccine. Moving forward, again, our efforts is to continue pushing to get vaccine into the county, continue coordinating with our healthcare partners, and building different options throughout the entire community to get the vaccine distributed. It requires a lot of patience from everybody. I know there's a lot of people who want to get the vaccine who fall under the current phase guidance and aren't able to. They're getting scheduled out for a few weeks. They're getting put on wait lists. And it's not the healthcare provider's fault. It's not our hospitals or our clinics' fault. They're doing the best they can with the doses that they receive, and they don't know what next week, how much doses they're going to receive. So just have some patience with that. And again, always look at our website for some updated information.
Thank you, Nathan. So we've got 2 questions. One I see about the quarantine recommendation. So I'll get to that question in a second as well. But related to the vaccine site, there's a question from Kayla. Will the State Fair Park site only be for Yakima residents?
Yeah, so right now, we are not necessarily turning away out-of-county residents at any of our vaccine sites, whether it's a clinic or what would be a drive-through site here in our county. So at this point, just like testing, anybody who comes would be able to get that. We do strongly recommend that people look at what options are available in their community. to get vaccinated, and also get your second dose. Also, getting your second dose where you got your first dose from.
Thank you, Nathan. And then I did see a question about the quarantine guidance. So I'm actually going to go ahead and share a graphic here where we can see, and this is available on our website. So again, this is something that's given out to everyone once they test positive for, or once they get tested for COVID-19. And just to make sure, can you all see the flyer that says COVID-19 in the workplace? Thank you. So essentially it is, once you get tested for COVID-19, obviously wait at home until you get those test results. Once you have tested positive, if you have confirmed, if you did test positive, you should wait at least 10 days since your since your symptoms first appeared, or at least 24 hours since your last fever or your last symptom ended, and clearly use whichever timeline is longer. If, however, you test positive and you didn't actually experience any symptoms, still wait at least 10 days from the day you were tested for COVID-19. And at that point, you can end your quarantine and thus return to work. So again, I do want to emphasize, we still do hear of a lot of employers who require a negative test result to return to work. And again, that is not something that we recommend. We do recommend that people use these time-based guidelines to return to work. So I will put a link to that flyer on from our website that anyone can have readily available, and also some of the links that Nathan referenced as well in terms of our website. And por si alguien está viendo en español, ya sé que estamos hablando en inglés, pero vamos a tener un video que va a tener todo traducido para ustedes en esta semana. Pero como quiera, si tienen preguntas, por favor, déjenlos ahí en el chat box, y también los puedo hacer las preguntas para Nathan o para Sean de las vacunas o de los restaurantes. Entonces, siéntense en confianza que puedan dejar sus preguntas, aunque hoy no vamos a poder hacerlo en español, pero sigan dejando sus preguntas o sus comentarios para nosotros también. And again, for anyone who's just joining us, we have Nathan who'll be able to speak to vaccines, and Sean who'll be able to talk about businesses, restaurants, and other types of questions. So Sean, I know we've been getting a lot of questions from people who are seeing lots of restaurants advertising that they'll be opening up for indoor dining. And so I think what's on people's minds is what changed, and really how can they determine whether something is actually opening using what was referenced as open air dining, which is something that was authorized, versus indoor dining, which at this point is not necessarily should be happening at least.
Yeah, Lillian, you're absolutely right. Indoor dining at 25% is not allowed until phase 2. By definition, open air dining and indoor dining are different, even though both potentially can be utilizing an indoor space. So what let's say you're a customer and you want to go out to eat, and you want to go to a restaurant that is, a safe environment under, phase 1 and the current case rates in our community. You want to go to a place that's utilizing indoor dining that's in an indoor area. Some key things you'll want to be looking for is you'll notice windows and doors will be propped open. There should be CO2 monitors around the dining area. A lot of restaurants would probably have their fans going if they have fans. Their HVAC systems will be turned up to keep moving air in and out of that building. So you're basically simulating an outdoor air quality in an indoor environment. So if you see those things when you go to a restaurant, it's safe to say that they're meeting the criteria. Now, if you go to a restaurant and all the doors are closed, all the windows are closed, and you don't see the CO2 monitors, things like that, that by definition is indoor dining, and that is not allowed until phase 2. So I would encourage people to use uniform best practices and making those decisions. Make the decision that's best for your safety, your neighbor's safety, and try to support our local businesses by going out to eat, and take notice on what they're doing. If they're doing it right, that is highly encouraged right now. And all these things, all these decisions we make on a daily basis, you know, supporting local businesses, but we're still wearing masks, we're still social distancing. You know, we're having accountability for us and our neighbors, meeting guidelines. That is what's going to help us move on to phase 2 by lowering our transmission rate, thus also lowering our hospitalizations and, you know, meeting the rest of the metrics that go with that. So that's what we encourage. That's what we're looking for out in the community for food establishments, is how they're meeting the criteria. I'll also say that the Department of Labor and Industries and the Liquor Control Board are offering consultation site visits to businesses, specifically restaurants, for the open air dining criteria. And it's a good idea to do. They come out, they evaluate your facility, they work with you and let you know how you can meet the criteria to possibly utilize an indoor space for open air dining, how it would qualify. And that's kind of an insurance blanket for a business, is you have that, basically you've been given the green light by the regulatory authority on these rules, and you can operate your business with the open air dining with confidence, knowing that you're meeting the standards. So that is what we encourage.
Thank you, Sean. It looks like we do have a question here. I see there's several others, but given that Sean's talking about the restaurants right now, we have a question from Kayla. What do restaurant owners have to do if they want to set up open air seating in their establishments? Do they have to call YHD?
No, they don't have to call YHD. What we can do is if a restaurant owner or manager calls us and wants to figure out a way to utilize the open air dining criteria, we, you know, we'll talk through that with them, asking a lot of questions. You know, can you open up windows on multiple walls? Do you have any large garage or bay doors? You know, do you have an HVAC system you can pair with those openings that make a wall permeable, allowing fresh outdoor air to flow through that establishment? Do you have CO2 monitors? Where are you going to set those up? We can kind of walk through those things and get them set up. But a restaurant is not required to get an approval by YHD or Labor and Industries or the Liquor Control Board to utilize open air dining. It's just encouraged that you reach out and talk with us about it. Have L&I or Liquor Control Board come for a consultation, because you just have that peace of mind and that confidence knowing you're meeting the standard.
Thank you, Sean. 1 second while I look through some of these questions. Thank you for everyone for participating. Y otra vez, los que están viendo, sabemos si tienen preguntas que las puedan hacer. One of the questions that we did get in general was, when are kids going to return to school? So earlier today, the Yakima Health District did send out some information that asked all high schools to develop plans to begin hybrid learning. We did specify high schools because the recommendation already stood from back in the fall for K through 8 to return to hybrid learning. So again, what the update was today was for the last remaining age groups and school groups that had been put on pause on November 15th. So yes, at this point, the recommendation is for all grade levels to plan for a phased return to hybrid, well, a phased beginning of hybrid learning for all grade levels. So again, we don't have more information to share tonight. We don't have panelists that can speak to more of those in-depth questions, but we will have a media press conference tomorrow at 11 a.m. that we'll make sure to live stream for everyone that's available, and also to have it, the recording on YouTube for anyone who can't make it. So if you have any questions related to that, still put them in the chat box. We won't be able to answer them today, but we can make sure that they get to people tomorrow. Y Consuelo, como sé que estás viendo, nomás todos los grados ya se han recomendado que regresen de manera híbrido. Entonces ya sería, lo más pronto sería febrero 16 de 2021. And actually the original question was the timeline. The timeline that was recommended was as soon as February 16th, 2021. So again, I'm going to take a quick look at what other questions we have. Okay, a question from Tammy. How close are we to phase 2? So Sean, I know you talked a little bit about that already. And so what I'm going to actually do is open up the dashboard, which is updated will be updated every 2 weeks now. You can find that on our website. And essentially what is being looked at is 4 metrics. Those metrics, as you can see, that's up. Those metrics being related to hospital capacity, related to what's the trend in testing, and also in terms of percent positivity. So when you go to the dashboard here on our website, it'll show you.
We're not seeing the same page you're seeing, Lillian.
Oh, thank you. Which page are you seeing?
The DOH vaccine resources page.
Thank you for that. So I will go ahead and put the link in where you can directly see that dashboard. The dashboard is broken up by county and by region, excuse me, the regions that every county has been placed into. And so again, you can take a look at that. It's actually really helpful to see how close we are. I do think, and I'll let Sean speak to this a little bit more, I do think we're pretty close. We have been seeing our numbers moving in the right direction. That's not to say that our numbers are necessarily great. We still are seeing high numbers every day of COVID-19 cases, but we are seeing a decrease. And so we're very hopeful that we can move into phase 2. But honestly, it really just depends on the activity that's happening in our community.
I'll also add to that is, there's more than just Yakima County's numbers we have to pay attention to, as we are partnered with Kittitas County, Benton and Franklin counties, Walla Walla and Columbia counties. So it's not just how Yakima is doing that's going to determine phase 2. It's all those counties make up the South Central region, and the 4 metrics are measured for the region as a whole. So, any one county trending, a better or worse direction might affect whether we can go to phase 2 or not. It's, to my knowledge, all the counties in our region are trending fairly well. We kind of been, hovering plus a few percent in cases per 100,000, minus a few percent for cases 100,000. Hospitalizations per 100,000 have been going really well. We're meeting that metric, as well as I think we are just meeting the metric for occupancy of occupied ICU beds. We are at minus 1% this last cycle for number of new cases per 100,000. So didn't quite meet that metric. We're getting pretty close. And then the test positivity rate is another metric, needs to be less than 10%. And we were at 22%, I believe. So we got a little bit more work to do. And again, in order for that to happen, it's using those uniform best practices in your everyday life. Wear the mask, social distance, avoid gatherings of people outside your household whenever possible. Things like that are really going to help lower transmission and help us get to phase 2.
Yeah, thanks, Sean. And I will add that I do see a lot of comments about, if just stop getting tested and then that'll help our percent positivity rate. It's actually the opposite is true. So of course, the percent positivity rate is high because we have a high amount of disease activity in our community. But if we have more people to go get tested, that's actually going to increase our denominator, which will actually bring the percentage down. So if we all commit to making sure that we get tested anytime that we may think that we've been exposed, or maybe when you're getting COVID-like symptoms, that's really going to make sure that we can both do enough testing to bring the percent positivity down and make sure that we're identifying anyone who is positive for COVID-19 and essentially isolate and make sure that we're not spreading it any further. So I just want to encourage everyone to get tested as soon as you think you may have been exposed, or if you have any type of symptom. I know there's some people who thought I was just congested, and they ended up testing positive for COVID. So just make sure if you have any thought that may be COVID, just go ahead and get tested. Our testing sites are still open, both in Yakima and Sunnyside. I know we've been getting questions if they're still open. Yes, they are still open. Yes, it's still free. And yes, it's still very much convenient. Nathan, there's a question for you from Esther. Is there a list you can be put on if there are leftover vaccines needing to be used?
Yeah, so at this point, a lot of our providers are making essentially wait lists. The goal is to certainly not waste any vaccine. So if you call and try to schedule, and a lot of them, instead of just saying, "Oh no, we don't have the vaccine," and turning you away, will oftentimes put you on a wait list if they are vaccinated, so they can ensure that they can bring someone in. It's really up to each organization on how they do that, but there is the opportunity.
Thank you, Nathan. There's also a question related to what if you know someone who has COVID, who's going out in the community, and really there's that. I think that's where we all need to again ensure that we're following the safety precautions for ourselves and for our families. Make sure that you're keeping your distance from others. Because again, it's something that we said before, and I'll say it again. Every time you're going out into public, you should assume that people around you may have COVID-19. And for that reason, make sure that make sure that you have at least 6 feet of distance, that you're wearing your mask, that you're sanitizing things that frequently, and that you're washing your hands frequently as well, especially as soon as you get home. So essentially, we all have to take care of ourselves and take care of each other. So really, that's the best option at this point, is to make sure that we have that assumption that we may be carrying COVID-19 and others may be as well. So let's do everything we can to reduce that risk when we're going out in public or meeting with others. And I apologize, it looks like my internet might have gone a little unstable there for a second, but hopefully that answers your question. I'll take a quick break to see what other questions you all have. I see a comment from Tammy about the link. Can you put in another comment, Tammy, about what specifically you're trying to reach with the link? And I can make sure that we send an updated link if it's not working for you. Okay, and just to remind everyone, Nathan, can you let everyone know what the vaccine rollout is going to be in terms of phases? I think hopefully most people know that at this point in time, anyone that's 65 and older, as well as anyone that's 50 and older that lives in a multi-generational household being people who either can't live alone or have to take care of someone who is of a different generation. So example, a grandmother or grandparent taking care of their grandkids, or an adult that's over 50 years old who can't live by themselves and maybe has their adult children living with them to take care of them. That's really what some examples of multi-generational household. And of course, anyone that's in phase A, which would be any type of healthcare worker. But I think people are also already thinking ahead about who's next and what would that look like. Do you have some insight on that?
Yeah, so it's still going to take some time before we're ready to move on to the next phase. And we certainly are going to be in line with the state. So when the state moves to the next phase or tier for vaccinations, we will follow, just like how we followed with 1B tier 1. So the next phase is going to be 1B tier 2, which is really talking about our high risk critical infrastructure workers that are 15 years and older. So K through 12 teachers, public transit, agriculture, food processing, things like that, which is going to be a large portion of our community, specifically with so many of our citizens working in that ag field. From there, it'll be 1B tier 3, which will be people 16 years or older with 2 or more comorbidities or underlying health conditions. Then we go to 1B tier 4, where it's that high risk critical workers again, but anyone who is under 50 years old. And so that includes, again, the same list of people in 1B tier 1. And then there's future phases that we're still waiting on the State Department of Health to roll out on specifically what includes those. That includes phases 2, 3, and 4. At this point in time, there's no specifics out there on that, but we know it's going to take several months for us to even get to that point. It's really going to take us throughout the spring and summertime to work through the rest of our phase 1B, including tier 2, 3, and 4. As we open up to each different phase, we will push that out to the community and be very public with who can get vaccinated and how they can get vaccinated.
Thanks, Nathan. We have another question from Jessica. She's asking, hi, Jessica. How are all the vaccines in Yakima a 2-dose vaccine where we have to go back a few weeks after we get the first?
Yeah, so at this point, the 2 vaccines that are approved through the FDA under the emergency use authorization are both the Pfizer and the Moderna, which are both 2-dose vaccines. There is a glimmer of hope for a 1-dose vaccine from Johnson & Johnson that is nearing the end and waiting to be approved at the federal level. But until that happens, it will be only 2 doses. And the Johnson & Johnson is looking like it'll be a little bit less effective than both the Moderna and the Pfizer.
Thanks, Nathan. We have another question about regards to vaccines. The question from Kayla, will there be a vaccine for children younger than 16 years of age?
Yeah, absolutely. So that's, when these vaccines get approved, they're getting approved under what is called an emergency use authorization, which gives it certain criteria like anyone 16 years and older only for those vaccines to be administered to. As we continue progressing and more of this vaccine gets administered on the federal level, there'll be more opportunity for clearance on people under 16 years of age. But we don't make that decision locally. That is up to the FDA and other organizations that are involved in the approval process of the vaccine.
Thanks, Nathan. And Sean, I'm just going to ask you one more time. I know we get lots of people that are super excited. They see that their favorite restaurant is open, myself included, and think, oh, great, I want to go support them. But you also get people who wonder, wait, is this safe? And I just want you to, one more time, distinguish between what is indoor dining and the open air dining so that people can make the decision about what to do.
Yeah, absolutely. Sorry about that. Indoor dining, by definition, is just that, indoor dining. You don't have any windows or doors that are required to be open. It's just normal inside the restaurant setting. So that, by definition, is indoor dining. Under open air dining, you can potentially utilize an indoor space by having what they call permeable walls. And what qualifies a wall as permeable is the ability to open up windows, large garage or bay doors, and then also have CO2 monitoring in that indoor area and keeping the CO2 levels below 450 parts per million. The idea behind this is we know that COVID transmission is significantly less in an outdoor environment. So if we can simulate the outdoor environment inside, then we make dining in an indoor space that much safer. So by definition, no permeable walls is indoor dining. Having one or more permeable walls and the ability to keep the CO2 levels below 450 parts per million by constant CO2 monitoring would qualify as open air dining. So when you go out to a restaurant, you can use that information to kind of, assess, where you're going to be seating or what business you're going to be visiting, and know exactly what you're looking at. Are they using open air dining guidance and meeting that criteria? And if they are or are not, you can decide to either not dine there because it's not safe for indoor dining at this point, or if they are utilizing open air dining, you know that they're simulating an outdoor environment, and that for phase one, it's been deemed that that is a safe activity to participate in.
Thank you, Sean. So for any restaurant owners, business owners, managers, just as you're announcing these openings, I think, again, the key is using that terminology of the open air dining. Those are the guidelines that I think people are trying to follow rather than the indoor dining. That's speaking to phase two type of guidelines versus what we can do now. Okay, and it looks like we have one last question for Nathan. Jessica's asking, are the vaccines safe for pregnant women?
Yeah, so the FDA and the CDC have approved the vaccines for pregnant women. Again, ensuring that the people who are getting that are following the phased guidance. However, it is highly recommended that you consult with your physician and discuss that and discuss options with your personal physician.
Thank you, Nathan. It looks like we have one more question in terms of data on our website being difficult to find. And so definitely open to suggestions in terms of what type of data people are wanting to look at, that we can ensure that we can have that available right on our front page. For now, I will go through quickly on our website just to show where things can be found for anyone that's interested as well. So on our front page, we do have our COVID-19 data linked at the front. So if you click there, we have lots of data on our website. And so again, very open to hearing from community members about what they would like to have featured first. When you look here, here's a COVID-19 data dashboard. And just to make sure, checking, can you guys follow me where I'm going with the COVID dashboard? Yeah. Okay, yeah. Great. Thank you. On this particular dashboard, you'll be able to see all the current cases, hospitalizations, deaths, and even vaccinations now. So information from the state can be found here. One thing to keep in mind, this is information that's reported by the State Department of Health. We also report local data every Tuesday on our website as well. But for now, we'll stick to this piece. This is a dashboard that's available where you can see how we are working as a state to meet our goal put forth by the governor, as well as how many doses have been given within a particular county. Again, going back to that data summary page, if you scroll down, you'll be able to find the roadmap to recovery dashboard. That's what I was referencing earlier, where you see each region and each metric being put up on this table. And us being the South Central, it looks like we are, that's not current, that was a screenshot. On this metric, you can see that the South Central region is actually reaching two of the metrics right now, two of the goals, but is not meeting two of them, that being the percent positivity and the trends in case rates. But we're close. So again, recently it was changed that you have to meet 3 out of 4 to move to phase 4, to phase 2. So that means that we are very close, and we're hoping when the next metrics are looked at, we can meet 3 out of the 4 to move into phase 2. So going back, we also post our case updates every single day. Again, as you can see here, we update them Monday through Saturday, and then on Sunday, we actually don't post them, but we do include them in Monday's update. So here you'll see the breakdown locally, as well as information on who's currently hospitalized and intubated. And back in November, we did do a video where you can access what an underlying health condition actually means. I think a lot of people have a lot of assumptions about what underlying health condition is. It's actually a pretty broad term, so I recommend everyone to watch that video to learn more about that. Finally, we do have information based on county and city. We update this information every 2 weeks, where you can see the cases and the change from the last update as well, if you're interested. We also have a map that updates by hotspotting information about cases. I do recommend, this is a map for the entire COVID response. So for anything that's a little bit more recent, I recommend looking at the second tab. which is the Yakima County 14-day case map. So when you look at that 14-day case map, you're looking at the last 2 weeks, which is more representative of what's currently happening. So in the last 2 weeks, it looks like the lower valley has actually been hit more with COVID-19 than some of our other areas. And of course, you can play around with it and zoom in and things like that too. And finally, we do have information broken out by race and ethnicity. We have always struggled with making sure that we have complete data. So it is a large, about a third of it is missing. That is something that's been seen statewide, but for the information available, we do have that updated as well. And then finally, relevant to the school announcement that was made today, we do update every week our school data. Again, this is information of people who have been at school while they were infectious with COVID-19 and have tested positive for COVID-19, that being 286 people from this update. And of those, 11 people were found to have tested positive, or excuse me, acquired COVID-19 while at school. So again, I'm definitely open to hearing what kind of data, graphics or things like that would be useful to people. Right now, we do have quite a bit of data. It's not necessarily analyzed in an easy to digest manner, but it is available. So again, thank you for your comments. I'm looking forward to hearing more about what people would like to see in the future. And with that, I'll take a quick look to see if there's any other questions. Thank you, Addie. Definitely, again, feel free to make any suggestions that we can work on. And yes, this town hall will be held weekly. We'll be doing this every week at 6 p.m. on Tuesdays. So we'll hope that more of you can tune in next week. For everyone who misses it, again, this will be available on YouTube. So feel free to share it with anyone who you think might have some questions that can be answered with today's update. So thank you, Nathan. Thank you, Sean, for your time. We'll see you all next week.
Thanks, everyone.